In this video, I'll be going over the post-operative evaluation for the Yamane technique and what to look for on exam. So as you know, the Yamane technique involves using a three-piece lens with cautery to create two terminal bulbs that are anchored to the sclera. Now, there are two common orientations. There's the 12 and 6 orientation. As you can see here, here are the flanges, and you'll see that on the slit lamp exam. And then there's also the 3 and 9 orientation, as you can see here. One orientation is not better than the other. Like I said, it's just a surgeon preference. Now, with the Yamane technique, the key things to look for, obviously, is checking the visual acuity, checking the intraocular pressure. The intraocular pressure may be low because this procedure does involve sclerotomies and often more than just a few sclerotomies. It may also be elevated, and I'll get back to that in a sec. You want to look for cell and flare. Any sutured IOLs may have cell and flare both early in the early postoperative period, but also in the late postoperative period. You may want to look for tilt. So some of these, this technique is very prone to tilt if the incisions are not exactly identical. One key point is a pupillary capture. So this is specifically seen in the Yamane technique, but the IOL can actually prolapse and be captured to the pupil. And you'll see that the pupil, it won't be the same shape that it is now, it'll be much bigger. And the optic basically will be more or less in the anterior segment, either partially or completely. If you see that, of course, you'll have to notify the surgeon. And surgeons will often place a peripheral iodotomy at the time of surgery to prevent pupillary capture. So when you're doing your exam, just look for a PI. But even if the patient has had a PI, a pupillary capture can still happen. Again, not common, but something to look for in your postoperative exam. This is the most important one. This refers to actually looking at the flanges. So here, you're doing your postoperative exam, you have the patient look down and you see the flange here, you have them look up, see the flange here, or alternatively, right and left. Why is this the most important? Because these flanges, of course, they're under the conjunctiva, but you have to make sure that they have not eroded through the conjunctiva. If they have eroded through the conjunctiva, then basically this is now external and is basically visible to the external world, and now bacteria can actually tract in and cause an infection. And what I mean by that is endophthalmitis. So if you see any evidence of flange erosion, that is an emergency. You need to notify the primary surgeon. What they'll do is then they'll place conjunctiva back over this area. They'll also make it smaller and push it down or refixate the IOL altogether. But this is the most important one. All sutured lenses, whether iris, scleral, fixated, all have a possible link with cystoid macular edema. So you want to do a good dilated exam and also do an OCT on these patients. And same thing with all sutured lenses. You always want to do a good peripheral retinal exam. These procedures involve manipulation with vitreous. There's always a possibility of a small increased risk of a retinal tear, retinal detachment, and so you just want to do a peripheral retinal exam. That's basically the key things to look for in your post-operative evaluation for the Yamane technique. Hope you found this video to be useful.